Dear students, good morning. Today we are going to understand about aqueous humor dynamics. This forms the basis for understanding a very dangerous disease in ophthalmology called glaucoma. Cataract is a disease which can be treated. So the blindness which cataract induces is called preventable blindness or reversible blindness, because once operated, patient becomes almost all right. But the straight opposite of cataract is glaucoma. Glaucoma is a disease which, if found out and treated, can only deal with restriction of the damage. It cannot better whatever is there in the patient. The patient's vision, or rather the field of vision, which has been lost, is lost permanently. Even after treatment, it is very difficult to recover this kind of vision. So, glaucoma forms a part of non-preventable blindness. It is in fact a silent killer of vision. So, such dangerous is the disease glaucoma, and to understand glaucoma, the very basic of what is glaucoma, we will have to understand aqueous humor dynamics. Aqueous humor is a clear fluid that circulates in the anterior chamber of the eye. Now, as a first part, you have to understand what is anterior chamber and what is posterior chamber. These are two parts of the anterior segment of the eye. Between the cornea and the iris, behind the cornea and in front of the pupil, you have the anterior chamber. Behind the iris and in front of the vitreous cavity, we have the posterior chamber. These two portions, that is the anterior chamber and the posterior chamber, form the anterior segment of the eye. Then you might ask, what is the posterior segment? Posterior segment, anterior segment is filled with aqueous humor, and the posterior segment of the eye is filled with vitreous humor. So this is the first point I want you to understand. The second point is the posterior chamber of the eye has ciliary processes, which is a part of the ciliary body. This is the ciliary body. It's a part of the uveal tract of the eye. It is a part of the uveal tract of the eye. And these ciliary processes secrete aqueous here. So if somebody asks you where the aqueous humor is secreted into, it is secreted into the posterior chamber of the eye. Then it comes through the pupil to the anterior chamber of the eye. Once it comes to the anterior chamber, then it goes towards the angle of the eye where there is a trabecular meshwork, and this trabecular meshwork drains the aqueous. So I'll repeat once more. Production of aqueous is in the posterior chamber. Drainage of aqueous is in the anterior chamber, which is on either side of the iris. This is very important to understand. So this angle of the eye or the anterior chamber edge of the anterior chamber, which is also referred to as the angle of the eye, is a very important part because it deals with drainage of aqueous humor. Should this not happen properly, then there is going to be pressure building up into the eye, and that is called glaucoma. In simplistic terms, glaucoma is more complicated, but at least for you to understand, in simplistic terms, better remember as glaucoma is a building up of aqueous into the anterior segment of the eye with a block of the drainage meshwork. This block of drainage meshwork leads to building up a pressure in the anterior segment, and that is referred to as glaucoma. So now we'll have to know a bit more about the angle of the eye. The angle of the eye needs a special lens called gonioscopy. A gonio lens can only see the angle of the anterior chamber. This is called gonioscopy. But when you examine the eye with the torchlight, or when you examine the eye with a slit lamp and use the Von-Herrick technique, here itself you can judge whether the anterior chamber of the eye is deep or shallow. Anterior chamber of the eye is deep is a good thing. We are a bit not worried that there will be a pile-up of aqueous happening here. But if the anterior chamber of the eye is very shallow, it is very narrow or shallow, then it is dangerous, because there is a chance that the angle can close. So that way you'll have to understand that the depth of the anterior chamber and the angle anatomy are bit interrelated. So this gonioscopy, if done in the anterior chamber, then it will show four structures. If you do properly gonioscopy, it will show these four structures. See, 1, 2, 3, 4. They are in that order. Schwalbe's line, trabecular meshwork, scleral spur, ciliary body. If all four of these are seen by me in a patient, then I refer to this as angle grade 4. I say grade 4 means all four structures are seen. If I see grade 3, then it means I see only 3 structures. I don't see the ciliary body. If I say grade 2, I mean I don't see ciliary body and scleral spur. I only see 2 structures anterior, Schwalbe's line and trabecular meshwork. That is grade 2. Grade 1 is just Schwalbe's line. None of the other 3 are seen. Only the Schwalbe's line is seen. That is grade 1. Grade 0 is nothing is seen. You don't see any structure. Then it is as good as closed only. The angle is closed. You are not seeing any structure. So this is gonioscopy. And there is a gentleman called Schaefer, who is credited with this classification. So you remember this as Schaeffer's classification. S-C-H-A-F-F-E-R, Schaeffer's classification of the angle structures. So having understood the posterior chamber, anterior chamber and angle structures, I'll once more detail to you how the circulation actually happens. So there is ciliary processes. The ciliary processes is very vascular. From this vascular plexus, there is aqueous secreted. Aqueous is secreted. And once this aqueous is secreted, it enters the posterior chamber of the eye. Then it circulates in the posterior chamber, comes to the pupil and comes to the anterior chamber. In the anterior chamber, it then tends to go towards the angle, and in the angle by the trabecular meshwork it gets drained. Once it gets drained by the trabecular meshwork, it comes to the Schlemm's canal. From the Schlemm's canal, it goes via the aqueous veins to the episcleral vein and gets drained off. So this is basically aqueous circulation. I'll repeat once more. Ciliary plexus, the blood vessels of the ciliary plexus. From there is secretion into the posterior chamber. Posterior chamber, mainly nourishment of aqueous humor is to the lens. Remember, lens is an avascular structure, so it needs nourishment, and that nourishment it gets from the aqueous humor. From this, the aqueous humor enters the pupil and comes to the anterior chamber. And in the anterior chamber, the aqueous humor nourishes the cornea. Cornea is nourished by the aqueous humor because remember, cornea is also avascular. Then the aqueous humor tends to go towards the angle of the eye, gets drained by the trabecular meshwork, taken by the Schlemm's canal, then drained by the aqueous veins, goes to the episcleral vein and gets drained off. So this is the aqueous circulation in toto. This aqueous circulation is very important to nourish two important structures. One is the lens and another is the cornea. Both are nourished by the aqueous humor, because when we study about the biochemistry of aqueous humor, we will understand that aqueous humor is not equal to plasma. Just because it is coming from the ciliary body blood vessels, it is not plasma. It is unique. It has certain differences from plasma. And this is maintained by the blood aqueous barrier. There is a barrier called the blood aqueous barrier, about which we will study. Then this aqueous humor nourishes the lens, nourishes the cornea, then gets drained off. So it's basically nourishment, which is its primary function. It also has other functions, but nourishment of these two important structures of the eye, the lens and the cornea, is done by aqueous humor. And this aqueous humor gets drained finally by the trabecular meshwork, goes to the Schlemm's canal, through the aqueous veins, goes to the episcleral veins and gets drained off. This method is called the conventional method of drainage. Okay, this is called the conventional outflow. Suddenly they'll ask you, is it the only outflow? No, there is another way by which aqueous is drained. Aqueous is drained by the uveoscleral meshwork itself. That is the uveal tissue, that is the iris, the ciliary body. All these areas also allow some aqueous to drain, and this is called the uveoscleral drain. The previous one which we saw is the juxtacanalicular and corneoscleral drain. Okay, juxtacanalicular and corneoscleral drain. Here one important point is, they'll ask you, of these three routes which aqueous has to exit the eye, which offers maximum resistance? Because we also understood that the resistance to the outflow is the reason for developing a disease called glaucoma. So if glaucoma is going to occur, then there is something which is preventing or obstructing the outflow. And the obstruction of the outflow is maximum done by the juxtacanalicular meshwork. This you remember here. It is a nice to know point. You can even remember basically as that there is a conventional outflow of aqueous through the trabecular meshwork, Schlemm's canal, aqueous vein, episcleral vein, conventional outflow. And there is an uveoscleral outflow which is through the uveoscleral network. If somebody asks you how much percentage through each of these outflow pathways, the conventional pathway takes almost 85% of our aqueous. The uveoscleral pathway takes 15% of our aqueous. So majority is again think it is conventional. So if there is a resistance to the conventional outflow, then glaucoma is going to occur. So that is the question which they'll ask you. They'll ask you, which is the maximum resistance offering part of the conventional outflow? Then you'll have to say that the juxtacanalicular meshwork. The juxtacanalicular meshwork is the maximum resistance forming portion. Maximum resistance forming portion. Okay. Now, last slide, we just touched upon blood aqueous barrier. I told you that though the ciliary plexus, can you see these plexuses? The ciliary body has small finger-like plexuses. These plexuses have these blood vessels, So from the blood vessels, aqueous is formed into the posterior chamber of the eye. Now you can ask, if the blood, the cellular portion and the plasma separate, and the plasma enters the aqueous humor, is it true? No, it is not true. Because if plasma enters the aqueous humor. Plasma has lots of proteins. You know that, like albumin, globulin, and fibrinogen. So there are a lot of proteins in the which enters the aqueous humor. Then the aqueous humor will become very plasmoid or very opaque. That happens in a disease called iridocyclitis. In an iridocyclitis disease, you will learn that there is lot of changes which happen in the aqueous, making it more plasmoid. That you will have to understand is a disease. It is not a normal pattern. So what is a normal pattern? What happens in a normal pattern? In a normal pattern, these proteins are not allowed into the aqueous humor. Proteins are not allowed into the aqueous humor from the plasma. The cellular portion is not allowed. The cellular portion is not allowed into the aqueous humor. So aqueous humor is basically most of water, almost 99% of water, and 1% of ionic element, which is bit different from plasma. The ionic element, the equilibrium of ionic element in aqueous and ionic element in plasma is bit different. In fact, the ionic element in plasma, certain ionic elements are higher. In aqueous, certain elements are higher. We'll deal with it in the next slide. But now you understand that they are different. So the aqueous humor is formed from the blood through a barrier, and because of that, this unique composition of aqueous fluid is maintained, and this unique composition contains certain ionic elements which are more than that of plasma. And this ionic balance is very crucial for maintaining the health of the aqueous humor, health of the anterior chamber of the eye, the transparency of the anterior chamber of the eye, and nourishment of the lens and the cornea. Now you'll ask me, then who is this barrier? What is this blood aqueous barrier? Interesting question. Remember here that the ciliary body has two layers of epithelium. Okay, two layers of epithelium. The inner layer is the non-pigmented epithelium, and the outer layer is the pigmented epithelium. So there are two layers of epithelium. Inner layer is the non-pigmented epithelium, and the outer layer is the pigmented epithelium. So in the non-pigmented epithelium, there are tight junctions. There are tight junctions in the non-pigmented epithelium. These tight junctions in the non-pigmented epithelium is the barrier, is the blood aqueous barrier. This blood aqueous barrier is constantly expected to be healthy. In fact, there is a question which will ask you, where does the blood aqueous barrier break down? The blood aqueous barrier breaks down in a disease called iridocyclitis, which we will discuss in a separate topic. Now you remember that the blood aqueous barrier is very necessary for keeping the ionic balance and characteristics of the aqueous, and this blood aqueous barrier is formed by the tight junctions in the non-pigmented epithelial portion of the ciliary body. So if somebody asks you what are the functions of the aqueous humor, it's very easy, very logical. I told you each of these, I told you previously even. I told you nutrition. I told you mainly nourishment of the structures of the anterior chamber of the eye, especially the lens and the cornea. Because these two structures are avascular. So there is no blood to provide them nutrition. The nutrition is provided by the aqueous humor. Similarly, the aqueous humor is also a medium where the metabolites of these structures are removed. Here I'll have to tell you a point. I told you the lens and iris are avascular. So any avascular structure will go through the anaerobic metabolism. So if you understand your primary biochemistry, then you will understand that there is aerobic metabolism and anaerobic metabolism, and in anaerobic metabolism, less ATP is formed, and there is a byproduct called lactate and bicarbonate. Do you remember that? That lactate and bicarbonate have to be removed from these structures, no? And for that also, the aqueous humor is the main vehicle. Aqueous humor is a vehicle for nutrition, and aqueous humor is a vehicle for removing metabolites. Similarly, aqueous humor maintains intraocular pressure. So two things can go wrong. There can be a block piling up of aqueous humor. So there is rise of intraocular pressure. We call this glaucoma. Similarly, vice versa can happen. There can be undersecretion or a stoppage or a ciliary shutdown. Because of that, aqueous humor is not being secreted. And aqueous humor is not being secreted will lead to hypotony of the eye. Hypotony. In hypotony also, the eye cannot survive. We'll presume that the eye goes to a pressure of 6 millimeters mercury. Then it cannot survive. In the 6 millimeter mercury, the eye will shrink. And that shrinkage is called phthisis bulbi. Phthisis bulbi. So phthisis bulbi is an important point which you have to remember. In hypotony, as you remember glaucoma in raised intraocular pressure. Okay. Optical transparency, very true. I told you there is no plasma-like proteins. Plasma proteins are not allowed into the aqueous humor, and that is very essential for maintaining the transparency of the eye. If the blood enters the aqueous, then it is called hyphema. If pus enters aqueous, it is called hypopyon. If protein enters aqueous, it is called plasmoid aqueous. So these aqueous will be turbulent. They will not be like very transmitting light. The transparency will be very less. So the patient will become developing very poor vision in these situations. If a clear aqueous is there only, then the patient will have good vision. This I also told you. There is a protective function for aqueous. All body fluids, remember, have a protective function for their structures. Here the protective function is, there is lot of ascorbate which enters the eye. The aqueous humor has lot of ascorbic acid, and this ascorbic acid is a protector from the UV light which enters. UV light enters. There is lot of, we understand that because of the greenhouse effect, there are a lot of holes which are developed in the ozone layer, and lot of UV light is entering. So you go around without any proper protection to your eyes, then lot of ultraviolet light enters your eye, and because of this lot of exposure to ultraviolet light, we have certain diseases in the eye, and one of those is cataract. One of the hypotheses of cataract is exposure to lot of ultraviolet light, and because of that, oxidation, and this is protected by ascorbate. Similarly, the inflammation of the eye, if there is inflammation of the eye, then the cellular and humoral immunity, to enter the aqueous anterior chamber. Aqueous is a vehicle. Aqueous is a vehicle for all these inflammatory mediators also. So these are the wonderful 5 to 6 functions which aqueous humor does. Biochemistry of aqueous, we touched upon in the first slide. We said that aqueous, though it is secreted from plasma, it is unique. I told you that it has certain things in high concentration and certain substances in low concentration. Low concentration is urea and glucose. Remember, glucose and urea are very low concentration. Bicarbonate and ascorbate and pyruvate and lactate are high concentration. You can remember it like this. Lactate, because anaerobic metabolism, lot of lactate is generated, aqueous takes it, so it is high. Glucose, though it is there in the aqueous, initially the hungry lens and the cornea gets nourished by aqueous, so they take out all the glucose from the aqueous. So aqueous has very less glucose. So aqueous has very less glucose, and aqueous has very high levels of bicarbonate, ascorbate, pyruvate and lactate. The refractive index of aqueous is 1.336. The volume of aqueous is just 0.3 ml. 0.3 ml. 0.3 ml is the volume of the aqueous. of which anterior chamber itself is like 0.25 and just 0.06 is the posterior chamber. We remember, no? Posterior chamber is where aqueous is first formed, then it comes to the anterior chamber and gets drained. That's that story. Composition, aqueous is almost 99.9% water, only 0.1% of solutes, and that too mainly ascorbate, pyruvate, lactate, bicarbonate, sodium, chloride, potassium, phosphate, glucose, amino acids. So this is the aqueous humor basics. These are very essential. So just you revise this slideshow. You go through it once more. Understand the intricate points. What is the secretion of aqueous? Who secretes aqueous? And how come it secretes it in a unique fashion without that much of mix-up between the ionic balance of plasma and aqueous? And how this aqueous circulates in the anterior chamber? What are the structures it nourishes in the anterior chamber? And where it comes to the anterior chamber finally? Once it comes to that angle of the eye, how it gets drained. And once it gets drained, which vein takes it up. And if this is the conventional outflow of aqueous, what is the uveoscleral outflow? How much of outflow happens in the uveoscleral system? And these are interesting. You revise them once more because subsequent slides on aqueous humor will be working up on these basics and telling you more about the disease process of glaucoma. So for that, you will need a strong foundation on aqueous humor. Thank you for now.